Hey guys, and welcome back to XO Medical Spa. And on this episode, we're going to talk about why I treat other places when you're telling me this is the issue. And one of the most common places I talk about is the jowl, and that's one of the places that shows us aging so much. So when you come into the practice and you're like, hey, can we fix this jowl? And I'm talking about cheeks, I'm talking about neck, I'm talking about bone, and in your head you're thinking, what the hell am I talking about? So this is what we're going to talk about today when we come back. On prior episodes, I've talked about the importance of the aesthetic consult because one, I want to know what your goals are, and then two, you understand why I'm coming up with the plan that I'm coming up with. So you and I come up with a joint plan together. Now, when it comes to the jowls, let's talk about the aging process that we talked about in the past. We talked about volume loss, we've talked about collagen loss, that leads to laxity, and then lastly, specifically for the jowls, how does muscle affect how my jowls look? Let's discuss the volume loss first. We talked about it where when we age, we lose bone, we lose fat, we lose muscle, and we lose collagen. Losing all those things are our volume systems. So when we lose that volume, our face that used to be held up here starts to descend and fall, and gravity takes over and it all settles down because gravity is always down. So that's why our skin gets taken this way and just settles on the lower face. Why specifically the jowls are accentuated will all come together when we talk about different things. But now, if we know we lose volume, bone, fat, muscle, we have to replace those things. Why do we see hollowing here for men? Why do we see hollowing in the lateral cheek here for women? Why do we see volume loss back here where we start looking gaunt and sucked up in this preauricular right in front of the ear area below the cheek? By losing the volume, all we have left over is skin. And that skin is taken down in conjunction with the laxity, what we'll talk about next. But by replacing that volume with fillers, by giving cheek volume back, you can see it lifts the lower face. By giving mid-face volume back, put back that volume, lifts the face. By giving preauricular jawline filler, it brings this back and replaces that as well. So that's replacing typically the bone loss and the fat loss in that area. Second part of that is why does our jaw, when we're younger, look so defined and angular? But as we age, the jowl is accentuated, but although you personally only see the jowl, I see something else. Look around it. If you look behind the jowl, which I'll show you a picture, it'll give you a better indication of it. If you look behind the jowl, you'll see bone loss. If you look in front of the jowl, the pre-jowl, you'll see bone loss. So you'll see two depressions, just like this picture shows. Those two depressions sink in, which further accentuates this pouch. So you see if I accentuate this, accentuate, you see personally this jowl that you try to fix. But the two attenuating causes are the two holes on bone loss, because as we age, we lose bone. Osteoporosis, our bones get brittle and weaker. And that's why we get this undulation of the jawline. So first, we replace the volume loss that helps lift everything out of the way, but you still see the jowl. The other part of this is we have to replace the bone loss along this area. So fillers helps reduce those two things for us. Now, part two of this is laxity. We've talked about laxity as the collagen loss. Collagen is the glue that binds our skin together. So when you lose that collagen, our skin that used to be very, very thick and hardy becomes loose and thin, and gravity takes over and takes it down again. You'll see this more on the aging client, 60s, 70s, 80s, where all they do is fillers, fill, and they have plenty of volume, but it just doesn't look right Because if you put too much volume into a patient that doesn't have thick enough skin to hide that volume, you get these artificial balls of filler, and you can really see that. You have to fix that epidermal layer, thicken that skin up, and it'll look healthy. You can put all the volume you want in the world, but if the upper skin doesn't look thick and healthy, you outwardly don't look thick and healthy. So let's correlate this to PDO threads or injectables such as Sculptra and Bellafill. What we're trying to do is induce better skin growth. No matter how much volume I put in, like that prior area that I talked about with fillers, if you don't thicken this upper skin, even with PDO threads, I can lift all I want from underneath. But if I don't improve that upper epidermal layer, that upper layer will just always drag and hold on to this area, and you'll always see jowls. So first, we've addressed the volume. 2, we've addressed the lifting with such things as PDO threads. But lastly, with the PDO threads, and most importantly, is I'm trying to thicken that epidermal layer. Our eyes are some of the thinnest skin on our body. That's why it shows aging so much quicker. Our neck has very, very thin skin. That's why it shows aging so much quicker. So what I'm trying to do is thicken the skin, thicken this skin, thicken this skin, back to more of this robust and hardy skin. And that's how you can help lift and reduce the jowls as well. Now that we've talked about volume to lift, now that we've talked about collagen induction to reduce the laxity, one thing that we forget about when it comes to the jowls, and I find this a lot in clients, is we don't talk about these dreaded things, the platysmal bands. So when I talk to a client, I'm like, hey, let's shoot Botox into your neck to reduce the downpull and reduce the jowls, I'll commonly get this look, the puzzled look, the, huh? No provider's ever mentioned that to me before. What does my neck have to do with my jowls? And as soon as I make them clench or tense, or what I commonly ask you to do is go ee, and doing that ee, you see it right there. This platysmal band, which I don't have a thick one when it comes to my jowls, it's more back here for me, but you'll see it. Do this at home. Grimace hard. You'll see this platysmal band run right up against this jowl, run right up against the corner of your mouth. This whole rubber band pulls down your mouth, and you'll see this on the aging client, why they always have a frumpy face, because you built up this muscle that pulls down the corner of your mouth. And you see right there, makes that pudge right at the jowl. And lastly, this rubber band that pulls down on the corner of your mouth. These rubber bands are just muscles. They get built up over time. People who work out a lot build up that clenching motion. People who clench their teeth a lot build up this clenching neck muscle. So Botox is a paralytic. If we shoot enough Botox into this area, what we're trying to do is atrophy the muscle, or shrink the muscle, or weaken the muscle. Muscles that get weakened, what happens to them? They shrink over time. Muscles that get weakened, they don't have enough of a strong pull. So if you're walking around always like this, and you'll see it on people, this muscle is always tense, pulling down on the bottom of your face, pulling down on that dreaded jowl that you're seeing. So over the next couple months, 1, 2, 3 months, as that Botox is kicking in, as your muscle is atrophying, if you can no longer clench, this jowl will get sucked right up, and the rest of your neck will get sucked right up, and this jawline will look incredible. But that's one of the common things I don't see. 1, you're not getting a full aesthetic consult. 2, you're not giving all the tools in the toolbox to really treat it. Similar to this area, we always hate these nasolabial folds, these small lines. Other providers will just go in and fill this, but we're not lifting. We're not lifting. We always want to correct the symptom. We always want to correct the cause and not the symptom. The jowl is a symptom of volume loss, laxity. So there's no way to just treat the jowl. We have to treat everything else around it. Muscle pull is the cause that is accentuating the symptom that you see in the jowls. So correct all those things, and hopefully that will get you closer to your jowl correction. So to recap, I know I threw a bunch of things at you guys, but in the end, take it as simplicity as it is. Treat the cause. In medicine, you treat the cause. You don't treat the symptom. A cough is the symptom. Try to find what the cause is. Nasolabial folds are the symptom of our face falling forward and down. Treat the cause before you treat the symptom. The jowls is a symptom of volume loss, collagen loss and laxity, and lastly, down pull of the muscles. Treat those 3 items and you'll see how the jowls improved, and hopefully even the jowls get resolved completely altogether. So again, if you like these episodes, remember, subscribe so you always get notification, and give that thumbs up, because if you like these episodes, I'm pretty sure many other people will like it as well. So by giving that simple thumbs up, pushes the algorithm, and you will get more in return when you see other videos from either myself or other providers as well. I'll see you guys on the next episode. Exo Medical Spa. Bye.